What led you to do this research? Pseudoarthrosis after a lumbar fusion negatively impacts on patient outcomes and is costly to treat. We wanted to find a better way to help patients achieve fusion. We know that noggin inhibits BMP2 activity, but BMP6 isn't inhibited by noggin, so this seemed like a promising approach to enhance fusion at lower doses. Plus, being able to use the patient's own blood clot keeps things safer and simpler, which is always a win. What unanticipated problems came up and how did you deal with them? The participating surgeons in this trial had to balance busy clinical duties with research demands. But with thorough training and continuous support, we were able to overcome these hurdles and ensure that the trial integrated smoothly into surgeons' practice workflow. Our team worked with surgeons and their teams in this randomized controlled double-blind trial to ensure that good clinical practice was followed by site staff and regulatory grade documentation was properly kept. Furthermore, all the patients in this study were treated with TLIF or PLIF, supplemented with pedicle screws. Even though with different clinical practice at each study site, proper training helps reduce the heterogeneity and improve the consistency of surgical procedures in the study. What findings surprised you? We were most excited about the early fusion rates, and these fusion rates were also correlated with significant improvements in functional outcomes and pain reduction on patient-reported outcome measures. This was a very encouraging finding. Should practitioners change their practice based on your findings? And if so, how? Not yet. First, we need a confirmatory phase 3 trial. That being said, the TLIF and PLIF results seem compelling for many patients requiring a single-level lumbar interbody fusion. What remains the most important question unanswered by your study, and how do you hope to address it? Our phase 2 study enrolled a relatively small population. We're conducting a phase 3 trial to confirm that the results are generalizable to a more heterogeneous population. Specifically, we're looking at subgroups of patients with diabetes, age older than 70 years, and those with multiple comorbidities.